7 symptoms of cervical cancer that no woman should ignore. Did you know that cervical cancer is the 4th most common cancer among women worldwide, especially among younger ones? While the average age for diagnosis is around 50 years, it's frequently found in women aged 35 to 44. According to the Centers for Disease Control and Prevention, around 11,500 new cases of cervical cancer are diagnosed each year in the United States, leading to approximately 4,000 deaths annually. Make sure to watch until the end because there's a list of the most common cervical cancer symptoms that you might be experiencing. Today, we will delve into what cervical cancer is, its symptoms, risk factors, treatment options, and much more. Cervical cancer, or cervical carcinoma, is characterized by abnormal cell growth in the cervix, the passage connecting the uterus and vagina. This sensitive area, the cervix, is located at the lower part of the uterus and is particularly susceptible to diseases. Cervical cancer predominantly affects women over the age of 25 and is primarily caused by the human papillomavirus (HPV), which is mainly transmitted through sexual contact. The cervix plays a vital role in serving as a barrier against infectious agents and in facilitating the passage of sperm. However, an HPV infection can disrupt these functions. When infected cells in the cervix begin to multiply uncontrollably, they can invade other organs and tissues. Over time, this can lead to advanced stage cancer, which is more aggressive and challenging to treat. Now that you have a better understanding of cervical cancer, let's discuss the 7 symptoms of this disease that no woman should overlook. Interestingly, the 6th symptom on our list might come as a surprise to many. Number 1. Unusual vaginal bleeding. It's particularly important to pay attention to any bleeding that occurs after sexual intercourse or between menstrual periods. The intensity of this bleeding can vary, and persistent bleeding serves as a significant warning sign. In cervical cancer, the tissues affected by the disease and their blood vessels become more fragile, leading to easier bleeding. As the cancer progresses, it can damage healthy tissue, which may also result in bleeding. 2. Vaginal discharge. While vaginal discharge is a normal bodily function, changes in its color, thickness, or odor can signal a health issue. Typically, healthy discharge is clear or white, thick, slippery, and moist, and lacks a strong or unpleasant odor. However, a tumor, like that in cervical cancer, can alter the vagina's inner lining and affect the nature of the discharge. In the case of cervical cancer, vaginal discharge may have a bad smell and be pink, brown, or have the presence of blood. Changes in color and odor, as well as the presence of tissue, can indicate the presence of the tumor. 3. Palpable mass in the cervix. A palpable mass in the cervix often signifies cervical cancer. Under normal conditions, the cervix should feel firm. However, the presence of a tumor or abnormal growth can alter this, leading to the formation of a noticeable mass. This is often detected during physical examinations, particularly in routine gynecological checkups. It's vital to be vigilant about bodily changes and to engage in regular preventive exams. Early detection and treatment of such abnormalities can significantly impact overall health outcomes. 4. Back and abdominal pain. Feeling pain or discomfort during sexual intercourse can be a common symptom of cervical cancer. This pain may present as sharp, a burning sensation, or cramps. Inflammation of the cervix, often associated with cancer, can make sexual activity painful. Moreover, it's important to pay attention to persistent lower back and pelvic pain, especially if it occurs outside of menstrual periods and without any clear reason. Such pain can be a sign of cervical cancer, potentially caused by a tumor pressing on bones, nerves, or other organs in the pelvic region. 5. Obstruction of urinary and intestinal tracts. Cervical cancer, due to its proximity to the bladder, can significantly alter urinary habits. Tumors or irregular growths in the cervix can press against the bladder, leading to changes in urinary patterns such as increased frequency of urination. Symptoms like blood in the urine, loss of bladder control, and recurrent urinary tract infections may also manifest as part of the disease's progression. Moreover, intestinal problems can also be indicative of cervical cancer. The growth of a tumor may obstruct the intestines, hindering the passage and digestion of food. This can lead to symptoms like bloating, vomiting, nausea, constipation, gas, and abdominal pain. However, it's crucial to note that these intestinal problems can be caused by other conditions, making it essential to seek medical advice for an accurate diagnosis. Before we further explore the following cervical cancer symptoms, don't forget to subscribe to our channel and activate notifications to stay updated with our informative videos like this one. 6. Pain and swelling in the legs. When cervical cancer spreads to the lymph nodes in the pelvic region, it can result in the development of tumors within this area. These tumors may press against the pelvic wall, leading to pain and swelling in the legs. Observing these symptoms and consulting a medical professional for a proper evaluation is crucial. However, it's essential to note that leg pain and swelling can also arise from a variety of other causes, including injuries, blood clots, circulatory issues, varicose veins, obesity, pregnancy, high salt intake, or certain medications. Therefore, a comprehensive medical assessment is necessary to determine the exact cause. 7. Weight loss. Unexplained weight loss is another crucial symptom of cervical cancer. This disease, like many other cancers, can significantly impact appetite and alter the body's metabolism. As the immune system combats the cancer, it may work more intensively, leading to an increased production of small proteins known as cytokines. These proteins can cause the body to burn calories more rapidly, resulting in the breakdown of fat and muscle, and ultimately, noticeable weight loss. For many people, the word cancer often invokes thoughts of a dangerous and potentially fatal disease. However, it's vital to recognize that since the 1970s, the survival rate for cancer patients has significantly increased, largely due to advancements in early diagnosis. In fact, when detected at an early stage, most tumors are treatable and can lead to favorable outcomes for patients. Regrettably, crucial symptoms are sometimes overlooked, either due to reluctance to seek medical advice or underestimating their seriousness. Risk factors for cervical cancer. Sexual activity, particularly unprotected intercourse, is a significant risk factor for cervical cancer due to the transmission of the human papillomavirus, HPV. This risk is further elevated in individuals with compromised immune systems. Moreover, other contributing factors include smoking and a family history of cervical cancer. Being aware of these risk factors and vigilant about the body's symptoms are essential steps in the prevention and early detection of cervical cancer. And with that said, remember that prevention is better than cure, especially regarding cervical cancer. The best way to prevent cervical cancer. Preventive measures primarily involve steps to avoid HPV infection, such as using condoms during sexual activities and implementing general cancer prevention tactics like quitting smoking and undergoing regular health screenings. HPV vaccination is also a crucial preventive tool, recommended for women aged 9 to 45, particularly those who are sexually active. However, it's important to note that vaccination does not replace other preventive methods. Safe sex practices remain vital, as there are various viruses and infections that can be transmitted through unprotected sexual relations. Furthermore, adopting a healthy lifestyle, such as quitting smoking, moderating alcohol consumption, and maintaining a balanced diet, provides the body with the necessary nutrients for proper functioning, contributing to the prevention of various health problems, including cancer. How is cervical cancer diagnosed and treated? The diagnosis of cervical cancer typically involves screening tests like the Pap smear, which detects changes in cervical cells. This test is recommended as a preventive measure, and if there are signs of cancerous cells, the patient may be referred for a biopsy, a surgical procedure for detailed laboratory analysis. Other diagnostic methods, such as colposcopy, are also utilized in cervical cancer detection. Colposcopy involves examining the cervix with a magnifying lens to study abnormal areas closely. If cervical cancer is confirmed, healthcare professionals may conduct additional tests to ascertain the type, stage, and grade of the cancer. Once diagnosed, the treatment for cervical cancer is personalized and depends on the stage of the disease, the size of the tumor, and personal factors like fertility considerations. There are three main approaches: surgery, chemotherapy, and radiotherapy. In cases of premalignant lesions, outpatient procedures performed in a gynecologist's office can effectively remove or destroy these lesions, preventing their progression to cancer. The surgical treatment for cervical cancer can range from a partial to a total removal of the cervix. In more extensive cases, it may involve a hysterectomy, which is the complete removal of the uterus. Chemotherapy is typically recommended for treating more aggressive tumors, particularly in advanced stages of cervical cancer. Radiotherapy, which includes external beam radiation and internal radiation, brachytherapy, has been effective in reducing cancer cells and shrinking tumors. These radiotherapy techniques are carefully chosen based on the specific characteristics and progression of the cancer. The selection of an appropriate treatment for cervical cancer is based on a comprehensive medical evaluation, personalized to each patient's unique characteristics. Therefore, do not hesitate to visit your gynecologist if any of the symptoms appear, and to have a semi-annual or annual checkup. Prioritizing your health and valuing your body are key steps in combating cervical cancer. Remember, early detection of cervical cancer can save lives. Did you already know about these symptoms of cervical cancer? We welcome any questions or personal experiences you wish to share in the comments below. This is a space for open discussion and sharing valuable insights about this important health topic. Together, we can help raise awareness and take care of everyone's health. For this reason, we encourage you to share this content on your social networks and help other women take proper care of their health. If you found this information valuable, please consider liking and subscribing to our channel. Don't forget to turn on notifications for more insightful content to help you live a healthier and more conscious life. To learn more about preventing and safeguarding yourself against cancer, watch these additional videos popping up on your screen right now. Thank you so much for your attention. We look forward to seeing you in our next video.